Thank you, Andrew. Okay, well, thank you to Wound Care Today for inviting me to present my free paper. Just to point out to you, obviously not just at Worcester, I'm a professor at Birmingham City University, and I feel I better say that or I'll be in trouble for not doing that. Okay, obviously greetings from Worcester, and Worcester you may know for two things. One, it has the beautiful gardens at Whitley Court, and if you don't know them and haven't been there, they're definitely worth a visit. And the other thing is Worcester sauce, and if you haven't tried that, that's definitely worth a try. So, I'm going to present a free paper which is about a compression garment survey. And many of you will know we've published quite a lot of things, and what we're often trying to do is trying to work out what are the things that we can do better that are going to be quite simple to change. So if we start with the things that are easiest, and then we'll do things that get more complicated. And one of the things that struck us that we needed to do something around compression garments. There's been quite a lot of papers that have suggested that we could do better, and we thought that we probably could. So what we thought we'd do is try and have just an overview of where we were in terms of Worcestershire within the community and the care home setting. So just a little thing, just a reminder about some of the things that people have talked about today in terms of lower limb care. And I always think sometimes the numbers don't really mean anything. So I live in a village and there's 350 people that live there. And we're talking here of 278,000. So it does you really good to actually really think through what do those figures really mean in terms of, for example, what percentage of your total population would that be? Just gives you an idea of the sort of numbers. Then the other thing we've talked about is, like Christine Moffat talked about how chronic edema was something, and she was talking about this in 2007. And if I'm really honest, I think we're only really getting to sort of be really a bit more proactive around this, and I think it's a good job too. The delivery of evidence-based care, I think, does remain somewhat challenging within clinical care, and I just want to highlight some of the things that we did. Okay, so we did a survey, and people were invited to take part, and there's no coercion or persuasion. We just invite people to take part. We normally do fairly well because a lot of people want to know what it is we're looking at now. So they would like to know what the questions are, and they're thinking, where are we going? And some people will think, what are you going to be doing? Because I'd like to be involved with it. Okay. We got 50 clinical staff involved, so people who were delivering clinical care, and we use people that also work in our care home setting because we've been providing clinical education training and support there for over 14 years. So we have a high expectation of the things that they can do, and they're involved in lots of projects we do. We've got clinical governance support. We always find it's the best way because then obviously we can do the things we want to do. Okay. So we asked people, how would you describe the process of prescribing compression garments? And you can see that the majority thought it was either very easy or easy. So fairly easy to prescribe, okay? So they're able to write out the prescription. That all sounds marvellous. The process of measuring. Now, I've got some people who thought it was very easy, some people easy, and some people, it's 24%, so a quarter of the people who were seeing the patients actually said it was difficult. And you'll come to why that might be more significant. Then we looked at whether they were satisfied that the patient always received the correctly prescribed garment, so 12 were very satisfied. 72 were satisfied, so that's 84% felt that they were getting the right garment. 16% were unsatisfied, so that's 16. That would be 16 people out of every 100 that you would see then that actually would be, I know, Pam's pulling a grimace and you're right, it's not good enough. Then he went on to say, so how often per month are you contacted regarding compression garment queries by the pharmacist? So it's quite a lot of time, isn't it? Some 2 to 4 times a month they would be contacted by somebody who was asking them some query relating to the prescription that they'd got for their patient. We've got people who were never contacted. Now, we have done quite a lot of work with compression garments for quite a long time and have quite a good sort of relation with our pharmacists' relationship. So I think that may be why we do get quite a lot of them speaking with our staff. The danger, I think, is when they're not, is actually if they don't come back with a query, that doesn't mean the problem's gone away, does it? If you think that you've got your garment now and you think you've got the right thing, of course, the challenge for us is what we found that people told us the most frequent problem that they would encounter was where the size was incorrect. Now, strikes me as to be quite important, that actually if it doesn't really fit the patient, they're very unlikely to be wearing the garment. So I think it's quite important that we actually get sizing right, and there are a number of other issues, but size was the sort of most significant. Now, this was an interesting one. People who are prescribing garments or compression when they have without an ABPI. Now, 58% provided class 1 without an ABPI where they felt there were no other sort of arterial symptoms. Now, what's interesting is of those people, 98 reported no adverse effects. Now, it may be that what we need to do, and we talked this morning about the lack of nurses and nursing for the future, is maybe what we need to do is have a clear strategy about when we will or we won't be doing an ABPI, particularly on those people for whom you may take an accurate history, and if they don't present with arterial disease, you could safely put them into class 1 compression, and therefore releasing more time for patients who need your skills more, and they'll be having a higher classification. So I'm not saying it's never important, but I think you have to do it is based on your clinical judgment. But it's just trying to challenge that you're always going to do something, and it's about how do we use our time most effectively. What's interesting from this is 98% of people said actually they didn't have any adverse effects at all. And I'm sure you all know a story of how something went wrong, and we always have those things, but I'm going to say this is what staff told us. Somebody reported an adverse effect, and what was interesting went on to tell us a little bit more about what had actually happened and how the patient had contacted them. So quite important, had a problem, but patient advice, were able to get over it. The other thing we asked people was about education and training. So in our area, we've been running accredited courses for quite a long time there, and obviously I had a background in working at the University of Worcester, so we ran quite a number of accredited courses. So 58% of those people had completed an accredited course, which is, I think, is a high number of people, percentage of people who will be providing clinical care. Of those, 50% of the people actually continue now to undertake Doppler ultrasound. So there are some people who did their course who no longer, for a number of reasons, continue to do that. Again, somebody had commented, I don't do it. I didn't really feel like I did enough because I only was doing a couple per year. And I think that's maybe a sort of valid reason. The other thing they said, so we've done a lot of training, and it's that thing, will you ever fulfil that need? As 84% said that they would want some further training. So we've educated people, and we have annual conferences and annual events, and we've taken people who've done an accredited course, and guess what? 84% of them still say they would like some more. Now, that could be because they're just trying to be really nice to us, but actually, I think that people do recognise that with the increasing range of products that there are available in terms of garments, actually people recognise that they really do need to keep up to date. So on our initial findings, I think education and training we found to be quite influential. And bear with me, because what we've done so far is to look at 50 members of staff. This definitely is something we're going to do some more work with, and we'll have some, I think, some larger numbers. What was interesting about education and training was that we did have a high percentage of people who'd actually done and were prepared to, I would say, a higher academic level, specific training. I haven't analysed the data to see whether the people who have or haven't done their accredited course actually told us some different things. So I think that may be the case, but that hasn't been done yet. Sort of made me think, can we reduce the time delays in receiving their compression garments? We had quite a number of patients who didn't receive their treatment for 7 to 10 days. Now, 7 to 10 days seems to me to be quite a long time. So we wanted to reduce the clinical time in terms of dealing with errors. Obviously, the service is all about trying to improve delivery of evidence-based care. So what we've started to think of is about what are our options, and certainly people have talked about it today, about how you gain access to the garments or the prescriptions, or whether you go off prescription, or whether you buy things, or whether you have a delivery service, trying to get people to think differently in the organisation, that actually We could be more efficient in how we actually prescribe compression garments. We could, I think, be better in terms of the patient outcomes, in terms of them tolerating and wearing them, and particularly where size is an issue. And we, I think, can think about perhaps more efficient ways of how we might do some of the things. So my initial findings led me to think, actually, guess what? We need to know a little bit more. But I think it hopefully gives you a bit of an insight into an area where we've got people that are quite skilled, but actually there's still things that you look around and you think, yeah, we can definitely make some improvements. If we can save time, we can get to the right garment, to the right patient, to the right time, and we get the size that fits, and we can do that in a cost-effective manner, that obviously those are our options for the future. So, thank you very much.